We're thrilled that you have joined the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for every meeting this calendar year. Each agency will have 15 minutes to share about services and referrals, followed by 5 minutes for any questions our attendees may have. We ask all participants to remain muted during the presentations. When we open for questions and answers, you can unmute to ask your question, or you may type it in the chat and we'll ask it for you. Without further delay, I'm excited to introduce that the 3 agencies for today are Hope Pointe, Alliance Health Center, and Turning Point Foundation. So I will turn it over. Do we have Hillary with Hope Pointe?
Hi, can you all hear me okay?
We can.
Great, excellent, okay. My name's Hillary Hardy. I am the operations manager, at Hope Point Crisis Center, and I am going to try to do technology and share my screen here. All right. Okay, can y'all see that okay? Okay, excellent. So I'm coming to you from Tuscaloosa here, Rural Tide, gotta get it in there. And we are part of the system of crisis care in the state that was kicked off by a grant-funded federal program or state-funded program through Governor Kay Ivey. We're the 5th crisis center to open in the system of care. There is also one in Huntsville, Montgomery, Mobile, Birmingham, and then there's a 6th one that's coming to us in Dothan. So we just opened up in October of last year. So we are a new facility, and we are under the umbrella of Indian Rivers Behavioral Health, which is our local community mental health facility, or agency rather. We have just opened in phase 1 of our a 2-phase project. That's what you see a picture of here. We did some renovations on this existing building to create the continuum of care that we currently provide, and I'll go into a couple of details about that. And then end of this year, we'll be opening phase 2 of our facility that will expand our extensive services. And I'll go into that briefly. So we are a crisis stabilization unit for folks who identify as being in a crisis related to either severe mental illness or a substance use disorder. That's any gamut of the mental health issues, anything from generalized anxiety or major depression, all the way to, bipolar schizophrenia, just the whole gamut of mental health care. We have a no wrong door policy, so anybody who presents to us and is a willing participant and says, I need help, even if they don't meet our criteria of being in crisis from a substance use disorder or a severe mental illness, we will provide a warm handoff, an evaluation and assessment to send them to that referral, and even transport if they need it to get there as well. We're 24/7, 365. You folks can come at any time, day or night. In our catchment area is the 11 counties sort of in the Midwestern region of the state. We serve Pickens, Tuscaloosa, Bibb, Greene, Hale, Perry, Sumter, Marengo, Dallas, Choctaw, and Wilcox. So if somebody is not in our catchment area, we may refer, perhaps to a crisis center within their catchment area, or again, we will just triage them, evaluate them, and then based on need, just serve them, do the next right thing and serve them despite being technically in our catchment area, but that's who we serve. We do have a temporary unit and an extended unit to provide a variety of services based on the severity of the client's case. In our 24-hour unit, our temporary observation unit, you can see here we have 16 chairs to serve 16. That's our max census for that unit. People are here 24 hours or less, so it's non-residential. I liken it to kind of an urgent care for your brain, right? If somebody, typically we see folks who've run out of, their medication and they're just experiencing active symptoms of a severe mental illness. And so we will treat those symptoms medically, psychiatrically with our nurse practitioner. We'll also give them a medical assessment with our RN and then a clinical assessment and care plan with our licensed clinician as well. And then throughout their entire stay, they're also provided peer support services from our both mental illness and substance use recovery peer specialists. Again, no wrong door. This is the other part of our triage unit. Like I said, we can serve up to 16 folks in our temporary unit. And then we also have a limited extended unit right now. We have 4 beds in that unit. When we move to our phase 2 expanded space, we will have 12. And that unit folks can stay up to 7 days, be provided a similar milieu of care. Right now, I'm just seeing, day in and day out, a lot of times, folks who need a medication that maybe takes longer to get into their system to stabilize, we'll bring them into that extended unit to observe and provide care for them. And then also, honestly, a lot of substance use disorder cases where we are trying to refer out and get them a bed in a patient treatment facility. And so we just need a couple of days to do that. This is our little outdoor space. It is a bit of a clinical environment, but I will toot our own horn that we really have a, stellar staff, a lot of folks with lived experience. We have 70% of our staff, despite their discipline, who are in long-term recovery from either a severe mental illness or a substance use disorder. And we've tried to provide just a warm home-like environment as much as we could to this clinical space. We're located in downtown Tuscaloosa. It's the old DCH occupational, home health building that we've renovated. And then we are opening up our phase 2 just right next door, a new 11,000 square foot build in January of 2025. But right off 459 at the corner of 15th Street in Greensboro. We love our location. It's really allowed us to develop really good relationships with places like the jails and the ER, of which, we are, one of our missions is really to divert folks from those pathways that don't belong on those pathways. So developing good relationships with all the precincts, the local law enforcement, the mental health officers, as well as places like DCH and North Harbor, to make sure the clients are appropriately cared for, and sometimes that is. In terms of referral, how can you send them to us? You can always call us, do a brief kind of on the phone screening with our RN, just do a little bit of care action plan and see if this is the right place for your client or someone you're trying to serve. Or the client can just be given the resource itself, our number, or they can, walk in the door 24/7, 365. We're here to, we also can provide transport as needed. So we're here to really catch them wherever we can, whichever step and every step of the way. We don't, we are not an all size fits all, but we, like I said, we do have somebody in a crisis that's related to a severe mental illness or substance use disorder is not their primary crisis. We can help them explore and navigate various pathways to other resources. And we have a team of discharge planners who help us not only with our outreach in the community, but also with community connections within our community, what we call our community resource unit. So again, like I said, we're a new system of care in the state. a new facility within our catchment area. So, you know, please spread the word, talk about us, talk about 988 and just, you know, the suicide crisis lifeline as well. And then we also, this is just a little shout out, we take donations. So we do provide all the, you know, self-care needs that clients may have while they're here. And so if you are part of an organization that's looking to make donations to a facility in need, we are always taking individually wrapped goods, toiletries, as well as male and female garments and socks. So I appreciate your time. That's all I have. You can also follow us on social media. Like I said, we are trying to get the word out there because a lot of folks are, you know, oh, I've never heard of you, or what is that? What's crisis care? And so we have a big following and do a lot of interacting on social media. So please scan QR code if you'd like to follow us or share us and just learn more about our progress towards our phase 2 and what's going on at the crisis. I'll be quiet now. Does anybody have any questions? Funny.
Yeah, Hillary, is there any phase that y'all are going to have actual detox beds?
We there are talks of that down the road. We also have in mind a phase 3, which would also be a children's crisis center piece of our unit, a children's division for adolescents in crisis. Because again, we only serve adults. I'm not sure I mentioned that, but that is a part of our criteria. Now, if an adolescent presents today in crisis, again, with our no wrong door policy, we are not going to say, you know, whatever to the 16-year-old who is suicidal, hey, you know, we're not going to serve you here. We'll still triage them and provide them evaluation. And then, you know, based on the severity, either hook them up with our children outpatient services in town, or maybe even transport them to Children's in Birmingham based on the acuity level. But yeah, there's it's not in the works yet. Right now, we're just trying to get phase 2 up and running, but our kind of mission and vision of Pointe Crisis Center Expanded does involve a detox unit as well as a adolescence unit as well. Okay, well, thank you for your time and attention. If you have any questions that pop up, you can shoot them to me in the chat while we hear the other presentations. So thank you. I'll stop sharing.
Thank you so much, Hillary. Again, that was Hillary with Pointe. Does anyone have a final question for her before we move forward? All right. So at this time, we will move on to Lonnie with Alliance Health Center.
All right. So I don't have anything to share on my screen, so I'm just going to chat with you guys. I put my contact information in there. That's my direct line and my email address. But I'm with Alliance Health Center. We're in Meridian, Mississippi, right there on the state line. Probably it's about an hour on the other side of Tuscaloosa. I know that because I drive it about 3 days a week. So it's been, I live in Alabama. So our program, we have a primary psychiatric program, and we also do primary substance abuse. On the psychiatric side, we can deal with chronic mental health issues, individuals that have had mental health problems their entire lives, and they typically do well for a while. Their medication gets off, they decide not to take it. Something kind of goes south, so they need to come in and be stabilized. We can deal with an acute situation where you have somebody who may be suffering trauma, have a traumatic event in their life, may have PTSD, may be suicidal and just need some acute stabilization. We also do detox for substance abuse and stabilization, and we also do residential substance abuse. We are a hospital-based program. Each one of these units are on different floors. So our different milieux, our different patient populations are segregated and they are separate. So people who suffer chronic mental health issues, they're on a floor with other people who are dealing with the same problems. And so we also have a dual diagnosis unit, and that's kind of where we may have some people who are on our acute unit who's needing stabilization, and somebody who's on our comes from our detox unit that we identify may have mental health problems, they, that unit's called transitions, and they're, a lot of times those populations are together, people who have co-occurring disorders. We can also do residential psychiatric placement. So if we have an individual that comes in, we can keep them in an inpatient setting up to about 28 days on the psychiatric side. On the substance abuse side, we can do detox stabilization, which is 7 days. Then we do 21 days of residential. And then we also have a partial hospitalization with housing on the substance abuse side. And we are a provider through Medicare with that. So if you have somebody who has Medicare, they could possibly be engaged in treatment up to 70 days in our program. We can detox them, stabilize them, another 21 days residential, step them down to partial hospitalization with housing. They do their treatment on campus with us in a separate setting from the hospital. And we have apartment complexes that they stay in after treatment. So they're on campus at 7 a.m. They leave campus at 7 p.m. They're taken back to housing on the partial hospitalization side. We accept all major medical insurances, and we are a provider for Medicare. We can take Mississippi Medicaid. At one point in time, we were taking Alabama Medicaid, but they decided they didn't want to pay across state lines anymore. And so there is some hope that we will be able to one day, but I don't think so. Personally, I think that ship has sailed. And so, if you talk to people in our business office, they're like, "Oh no, we'll get it back." It's not coming back. And so, but we can take Medicare. Some of the Medicare supplemental policies are a little more difficult to deal with, like the Humanas. They just don't provide a lot of care. But all the other supplemental policies, we work really well with, try to give people a good positive treatment experience. We do transport. So if you have a client that is in need of transportation that needs help, we can do transport. Transportation has to be set prior to 3 o'clock or we will not be able to pick them up the next day. We have contracted, I guess what you would call sober transport. They're transportation companies that specifically deal with mental health and substance abuse issues. And so availability, people say, "Oh, you transport." Well, it's not calling an Uber. Sometimes it takes a little while to get it set up, but we do transport and try to take care of folks. We are a provider through the Compact Act, and this is something that a lot of people don't know. I talked to a group that have a grant through the VA for suicide prevention, and they weren't even aware of it. So let me tell you about the Compact Act. The Compact Act states if you have a veteran that is suicidal, they can be admitted into a facility that is a provider to the VA without an authorization, without anything. You bring them, if they're suicidal, we're able to get them admitted, then we get them registered with the VA, and then we get reimbursed at our Medicare rate. All right. And so basically what it is it's giving veterans the ability to access, stabilization and residential care through the VA at our Medicare rate. So if you have a veteran that is suicidal, that needs stabilization and some residential, we can keep them up to 30 days. And that 30 days gives us enough time to get them registered with the VA, get them set up with some aftercare once they leave. Because we do partial hospitalization on the psychiatric side, but we do not provide housing for that. So that's pretty much for local people there in the Meridian area. We do get some out of Sumter County, right across the state line, because that's where we sit. But that's basically who we are at Alliance. My phone number is in there. My email address is in there. If you want additional information, just reach out and tell me. I'll be happy to send it to you. If you want me to come talk to any of your programs and explain to them what we do, I think we're a great resource for people, that kind of fall into that area of who we specialize with. Any questions, comments, or snide remarks? Thank you.
thank you for sharing. We'll give everybody one last second if you have a question for Lonnie and Alliance Health Center.
Can you expound on I was looking on your website, the adolescent program that you guys have?
Yeah, I don't talk a lot about our adolescent program, so just because we stay full. So on the adolescent side, we have and I forget the name of them. Everything's got a name. So our Bridges program is 12 to 17, and we have 40 beds there. We have 20 male and 20 female beds. That is for acute psych stabilization. And so if you have an adolescent that is had one admitted yesterday that had become manic and had been up several days and just really dysfunctional, that type of patient, or someone who's suicidal, or somebody who has extreme behavioral issues and problems like that. So that is our adolescent psych unit. That unit pretty much stays full. It's been full since I've been there. There's been a couple of days that we would drop down to, have 3 or 4 beds available. But it is a great program. We take commercial insurance there. We take Mississippi Medicaid there. And they do an excellent job, but it's acute psych stabilization. And then we have 60 beds that is long-term residential psych. And so we have 30 beds for female adolescents, 30 beds for male adolescents, and then we have 30 beds for male adolescent sexual offenders. They don't call it offenders. I'm new to Alliance. I can't remember what word they use, but it's not offender, but it's adolescent males that act out sexually. But that's just kind of what pops into my head because they do have legal problems. All 3 of those units are constantly full. All 3. I mean, it is that those units we never have bed availability. We have contracts with different we have contracts with the Mississippi Department of Mental Health and different counties and different juvenile court systems. And if there's 3 beds available, there's 3 kids coming in. And so those 60 beds are, it's actually 90 beds because I can't do math. Those 90 beds are constantly full. Oh, no, it's 60 beds, 246. Okay. I'm getting over COVID. My brain's still not working very well. But but those 60 beds are constantly full through contracts that we have. On the acute psychiatric stabilization, we do have bed availability there. But it's kind of probably just like anywhere else in the state of Alabama. You may call and we may or may not have a bed. I was really surprised. That's a new area for me in my professional career, has been on the primary psych on the adolescent side. I didn't realize there were that many children that needed, immediate psychiatric care like that. But we are a great resource. If you're trying to place somebody and you can't find a bed, you might as well try us. I can't promise you that we would have one, but our admission process there tends to be pretty simple on that side. So we do not deal with any eating disorders on that aspect of our program. Any other questions around that?
It's a great question. We'll give anyone else just a moment if they think of anything. Also, if we have time at the end and you have come up with a question, we can circle back around to that. So thank you so much, Lonnie, again with Alliance Health Center in Meridian, Mississippi. We appreciate you sharing with us today. So at this time, we will move on to Turning Point Foundation, and we have Brian with us.
Hey guys, I hope everyone can hear me okay. We all good?
You're good.
All right. Thanks for having me on here. I appreciate what you guys have shared so far. I was curious about the adolescent adolescent program you had on, Lonnie, because unfortunately there's such a need for it, as you're expressed in the fact that you have no beds. So, you know, it's one of those things that we typically run into with really desperate parents. So thank you for doing that. I'm gonna talk a little bit. My name's Brian Stockard. I am the executive director for Turning Point Foundation. We're located in Thorsby, Alabama, which if you do not know where that is, you are not abnormal. We're almost halfway between Birmingham and Montgomery, about 40 minutes from Birmingham. We primarily service both of those areas as well as pretty much anywhere in the state. We are a 501c3 nonprofit, and we have been around for about 32 years now. So just to kind of give you a little bit of background, what we are is a 90-day men's recovery residence. We're considered a level 3 recovery residence. Our program basically consists of an immersive 12-step program with a Christ-centered emphasis on it. And so just to give you an idea of what it looks like there, you know, actually my background will tell you kind of what the actual physical location is. That is one of our buildings, but our website is turningpointal.org if you want to find out any more information. As I mentioned, we are a 90-day program for men. We currently house 28 guys in our main dorm. We have an additional program for guys that would like to extend their stay, and we typically have about 7 or 8 that will stay on there. To give you a little idea of what exactly we do, I said we're a 12-step immersive program. We are very intentional about the way that we structure things as far as the ability to do actual group class work and do things related to the 12-step component, but also very much focused on the individual work that I believe is required as somebody that's in long-term recovery. I know how important really diving into the nuts and bolts of everything is. Our program is also a Christ-centered program. I tell my guys and I tell my staff, you know, we are a very grace-filled. My mission for us really is to be as grace-filled and show as much mercy and compassion as you could possibly show. I think it bleeds over into our program and the community that we have established. The guys there really kind of buy into. I would say not a somewhat of a laid back atmosphere, but give them a lot of time to really reflect and spend time working on themselves. We do not send them out to do any kind of work while they're with us. They're there pretty much focusing on what it is that has gotten them to the point they're at today. So we offer experiential learning. These guys have the opportunity to do a lot of different things. We do equine therapy. We take them to things like whitewater rafting at the Ocoee. We do paintball, softball, all kinds of activities that kind of keep them moving. They have a gym and the opportunity to work out. We also give them one-on-one counseling. We have pastoral counseling. We have guys who act as coaches for each one of these individuals and gives them a chance to kind of walk through some of the trauma and struggles that they've had. We also bring people out to speak. We have a good number of guest speakers, usually two to four a week. We also take them out to church and to AA meetings. So typically we keep them pretty busy, but we give them enough time to sit, so they have to kind of sit in those feelings that we don't like to do sometimes. So as I mentioned, we service pretty much the whole state and certainly get a lot from out of state. Also, we are self-pay. We are not a medical facility. So if someone wants to come to us, and they're wanting to get sober and get help, we're gonna fight like crazy to try to get them there. We offer typically partial scholarships for guys who need it. And you know, we rely a lot on donations, and obviously that is a big part of what we do. But like I said, we're primarily a self-pay, come in and spend 90 days with us. The one thing that I think we do kind of surprisingly, it means a lot to these guys. We've got a chef that is basically on with us who I tell him, if you're not fat right now, just go ahead and plan on getting that way, because he wears us out. He's worked in 7 different cuisine types, and he worked for a chocolatier in New York. So yeah, if you're struggling coming in and is a little bit underweight, we can fix that problem too. But yeah, so our mission really is just to love on these guys and give them every tool we can to help them stay sober. As they leave us, we really try to steer these guys into some type of sober living environment. And keep them in some type of safe program as long as we can. But yeah, I mean, I think the big thing is for us is we want to give them hope and a chance, and be the hands and feet for these guys, and show them. By the way, everyone in my program, everyone that works on our staff, is in recovery, including myself, and most of them have been through our program. So we've got a lot of guys who know what it's like, and I think that's very important. So with that, I'll open it up if anybody has any questions or wants to know more about it. Yeah, let's go.
Brian, if somebody wants to contact y'all about your services, getting a guy in there, what does that look like? What's that intake, the front end of the intake process look like?
Yeah, so they would they would call our main intake number. I think I put it on it should be in the chat. Typically what we do, we assess them by phone, and if detox is required, we generally will work with a few of the different detoxes around here to get someone into detox, and then bring them in, generally transporting, depending on who the detox is, we'll have them brought to us from there. But as far as what is allowed, not allowed, typical medications, we do not do MAT. We are an abstinence-based program, and so we kind of establish all of that on the front end, and then hopefully these guys, we work with a lot of court systems. We do a lot to kind of manage all of that for them. But our main requirement is the desire to stop using and drinking, and that's the biggest thing that we look for. And we'll work on the other things as well. Anybody else?
So what is the entrance fee for someone to come for 90 days?
So for 90 days, it's $7,500. So we generally do it $2,500 a month. Right now, I would say about 35% roughly have some type of scholarship. So it really just varies depending on where we are more than anything. But yeah, it's a good question.
Thank you.
Anyone else?
Thank you, Brian, with Turning Point Foundation, for sharing your resource with us today. I'll give everyone else just a second if you have a question for Brian. And also at this time, we will open things back up. If you have a question for Hillary with Hope Point or Lonnie with Alliance that you have thought of, feel free to ask any of our 3 presenters any questions that you may have. All right. So at this time, I would like to say thank you for joining us today, and that we hope you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Again, please join us on June the 5th for our next virtual meeting, and I hope everyone has a wonderful afternoon.